Thank you, Governor, and thank you for all that the team is doing to help bridge Illinoisans as we get through this pandemic. These daily updates are critical in keeping Illinois informed. As difficult as it is to hear the news of more cases and deaths each day, I do believe sharing this information will keep us focused and remind us of why we all need to continue doing the right things. Doing the right thing will eventually lead us to these numbers decreasing and eventually ending this current pandemic. Today we are reporting 330 new cases, including 3 deaths. These are now affecting 35 counties across our state. Unfortunately, the pandemic in the United States and, of course, here in Illinois will get worse before it gets better. We understand that. We have seen Illinois cases in all ages, and we know we'll continue to see more cases in all settings. We've provided extensive guidance and are working tirelessly with these nursing home facilities on infection control practices, individual and group monitoring, isolation and quarantine, and health and medical care. But we will see cases continue to grow, which is why it's so important that we all take action to reduce the number of people who are infected and shorten the duration of this pandemic. Many questions are asked about why some people are not able to get tested. Let's review the process. Again, it still starts with your clinician. The clinicians will evaluate you. That should start with a phone call. If you feel you need to talk to your doctor about your symptoms, call first. You can do a telehealth visit where you are explaining what your temperature may be, what your symptoms are, and in fact, they may be compatible with COVID-19. Your clinician will assess your symptoms, and based on the severity, they can determine whether it's even useful to test or not. The majority of people who don't have severe underlying conditions will probably not need to be tested and will not have a test recommended, but instead will be told to stay home. The guidance now is to stay home for at least 7 days or 72 hours after your symptoms and fever abate, whichever is longer. But other considerations that may guide you to actually get testing are issues such as the occurrence of local community transmission in your jurisdiction. Clinicians are strongly encouraged to test for flu or other causes of respiratory illness. But the highest priority for testing of COVID-19 is for hospitalized patients and symptomatic healthcare workers and patients with severe underlying conditions that make them highest risk for severe complications, including death. And the final priority is, of course, healthcare workers and first responders, and the critical infrastructure workers who also are symptomatic. Again, you should not be tested in the absence of symptoms. No one is immune to this virus, not even if you are healthy, but not everyone necessarily needs a test. This virus is affecting every race and every ethnicity. Right now, we know of the counties that are involved, but we know that the number of counties will grow as well. Continue to stay home and continue to practice social distancing. Protect yourself, protect your loved ones, and protect your entire community by following these same instructions you've been hearing every day. Wash your hands for 20 seconds with soap. Cover your cough or sneeze. Stay home. Clean frequently touched surfaces. Together, we are protecting all of Illinois and decreasing the number of fatalities from this extraordinary event.